Hello, Medicare Advantage Risk Adjustment operators, innovators, and learners. Welcome to another video session of the Hills Academy Risk Adjustment Made Easy, the Medicare Advantage kind. I am your host tutor, Dr. Prince Belwa. If today is the first time that you're joining us, we want to say welcome. If you have been with us over the months and the years, we also want to say welcome and thank you for joining us in April as we begin a new topic. This month, we are starting Duals Decoded. I had the privilege of going to the Rise National last month, and I did a presentation on the One Big Beautiful Bill and its impact on Medicare duals. And it was really well received. And based on the comments that I received, I wanted to dedicate this month in looking deeper at the duals population and how the duals variables affect their Medicare Advantage risk adjustment. So this month we'll dedicate the month to duals and decode duals in a very simple way that you can understand and utilize for your work. For today, we are looking at who are the duals. Who are the duals? So what is a dual eligible? A dual eligible is an individual that is entitled to both Medicare and Medicaid benefits. On the Medicare side, age is 65, they are disabled or have ESRD or ALS. And on the Medicaid side, they are low income. And therefore, because of both of them, this person qualifies for both Medicare and Medicaid. Within the dual bucket, those that qualify for both Medicare and Medicaid, there are also two broad categories. There is a full benefit dual eligibles, and then there is a partial benefit dual eligible. So a full benefit dual eligible has complete Medicaid benefit on top of the Medicare benefits. And a partial dual has Medicaid, helps with the Medicaid cost sharing only, but doesn't have the full Medicaid benefits. So all duals are not the same. On a very broad level, there are full dual benefits and partial dual benefits. And then you go to the third category, who are non-duals. If I'm looking at the entire Medicare population, there is a Medicare only who are non-duals, and those that are Medicare and Medicaid. And within that, there is full dual eligibles and partial dual eligible. So if someone says, I am dual, you want to go further down and ask full dual or partial dual, because depending on where the person is, it will affect several other things downstream, especially in this area. We are talking to how that affect Medicare Advantage risk adjustment payment. So have that in mind. The two broad buckets, the full dual and the partial dual, and then you have the non-duals. Why dual status matter? And looking at the chart over here, which was pulled from Mimi Labs, leveraging the CMS data, there are about 12 million Americans that are dually eligible, which is a little over 18%. There was a peak, and then there's after the public health emergency, you can now see the dual population now unwinding down. There are about over 12 million Americans who are dually eligible, and most of the duals are mostly complex and high cost population in the system, in the healthcare system, because of all the other social determinants of health that most of the dual population may have. And the dual status affects risk score calculation depending on the model segment. It affects the payment amount because of the model segment that the dual beneficiary may fall into. It affects a frailty adjustment for PACE and also for SNP. So knowing the dual status also affect that part of your overall capitation payment. And then cost sharing rules, and then enrollment into D-SNPs, which are dual SNPs. And I have a video that I cover the different types of special needs plans, which are the SNPs. And I will link that in here that you can also watch it if you want more details. But the dual population really matter, and understand the correct dual status also matters to your ultimate risk score, so that you have the necessary resources to be able to take care of such a complex population within our health system who really need help. That is where we will end for today. Just an intro to the duals. As we go into the subsequent weeks, we'll be taking each of these and several parts of the dual population to dig a little deeper in understanding how that affects their risk adjustment payment. Otherwise, if you are new to our channel and you have not subscribed to our email list, I will invite you to go to our website, www.thehillsacademy.com. You go to the Risk Adjustment Made Easy site, and you'll be able to get a signature gift from Kiosk to Clarity, the essential comparison cheat sheet of Medicare Advantage risk adjustment different data sources that compares the different data sources that I leverage for Medicare Advantage risk adjustment for you for free. If this has been helpful, I encourage you to like, to share, to subscribe, because it helps us to reach a wider audience. Bye for now.